Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host, President and CEO of Bristol Health. And I am here today with Dr. Lebaschi, who is a orthopedic surgeon that's joining Bristol Hospital. Tell us about yourself, Dr. Lebaschi.
Thank you so much, Mr. Barwis. It's Amir Lebaschi. I'm an orthopedic surgeon. I recently joined Bristol Health. So excited about it.
As are we.
Thank you. Thank you so much. I finished my residency at University of Connecticut, and I did my fellowship in Michigan, Oakland University, William Beaumont. And I just recently joined Bristol Health. I was a general surgeon prior to that, and I was a plastic surgery resident too, but then life events kind of kindled my interest in orthopedics, so I pursued that career, and here I am.
Yeah, so you've had, quite an interesting background, having plastics to general surgery and now orthopedics, and now you just finished a special fellowship. And so talk to me a little bit about you had said to me at one point that this fellowship or this kind of focus on sports medicine has now really kind of transformed into something else. Yeah. And I'm curious about that.
Exactly. The concepts and techniques in sports, orthopedic sports, also known as sports medicine, is now applicable to a wide variety of orthopedic problems. So it's kind of common practice for fellowship-trained orthopedic surgeons to practice modern general ortho. It means that you can actually treat every single joint, major joint in upper or lower extremity. It's just a matter of your preference or your training. Otherwise, the concepts are applicable to all major joints: shoulder, elbow, hip, knee, ankle. My personal interest has been hip, but I was very diligent to learn as much as I can to provide a comprehensive spectrum of orthopedic service for shoulder, hip, and knee.
So talk to me a little bit about how that, because you often hear people talk about, I have pain, I don't know what's going on, how does one think about this now, especially given what you just said about modern orthopedics?
Modern general orthopedics.
Modern general orthopedics. It feels to me like it's kind of a full circle thing.
Yes,
it used to be general orthopedics. Now we're kind of going back to the future.
Yes. Anyway, that's exactly. However, many people who choose this specialty are mainly concerned and want to focus on the sports-related injuries. That's also a legitimate, kind of common or popular field of practice as well. So I would say, with the pain in any of your joints, seeing an orthopedic surgeon is going to help you have a full, comprehensive evaluation of what's going on. That doesn't necessarily mean that you will benefit from surgery or will need a surgery, but at least you would know what the problem is. And your orthopedic surgeon can tell you through history, physical examination, and judicious use of any other modalities that we have, what the problem is. Is it something that can go away by itself? Is it self-limiting? Is it an overuse? Is it something that requires treatment? So you will have an idea what it is and what my options are. An orthopedic surgeon can tell you what the options are. And we call it a shared decision making, which is a very popular kind of mentality at Bristol Health. And I'm very happy to learn about it more. That we will sit there and we will go over the pros and cons of these options. And you can choose based on your needs, based on your lifestyle, based on your logistics, or anything that you need to consider for that treatment. I would say, well, I might be biased as a surgeon, but still surgery is probably the most durable treatment for a surgically correctable problem, but not necessarily the first step. So we will go through trials of some management options before we definitively decide surgery is for you. In that regard, I can provide the full range of treatment for common shoulder, hip, and knee problems. Arthroscopy, open procedures, deformity correction, fracture, problems that people are born with and they were not recognized when they were younger and they are carried over to their adulthood. And ultimately, if the joint is beyond help, we can do the replacement. Beside these surgical interventions, there are a lot of other things that we can do because, as I said, patients may come in, I can't get the surgery now. I know my knee is bad. I know my shoulder is bad. I know I have a torn rotator cuff. I know my shoulder is unstable. I know my ankle is bad, but I can't do it now. I'm not medically ready, work-related issues. Can you do something for me to get me through this? Then that's what the sports medicine can offer too. We have a lot of options in the sports medicine, orthopedic sports, including injections, biologics, an expanding field of treatment. A lot of them are still investigational, but we have proven tools available. And one of our newest skills that we're going to have at the Bristol Hospital is cryoneolysis, which is a technique to provide pain relief by freezing tiny nerves that we can identify and we can implicate in creating the pain feeling that patients have. So we can freeze those nerves and those can provide long-term pain relief. But the most important thing is that we have already talked about what the problem is. We don't want to just mask or just hide everything under the carpet. So that's the benefit of seeing your surgeon, because he can inform you, he or she can inform you of what is going on without giving you a false sense of security. I can make your pain away, and then you will come back 6 months later with a much worse situation. The beauty of orthopedics, especially in the sports fellowship, is that we have a lot of options for a variety of problems, different age groups, different pathologies, based on patient's need.
Wow, you just said a whole bunch. So I'm just going to take you back to something that, and I had this conversation with a woman a couple nights ago at a function. Mother's aging, I think it was her mother, and trips, falls, things like that, and concerned about what's the cause of this? I mean, and you talked about the team and shared governance and all these other things, or shared decision making, and where do you start? And you also talked about just going to your orthopedic surgeon. And I remember doing this for my dad. I just said, he's falling all the time. Let's make sure his hips, knees, joints, and everything else is all right. And no different than going to your dentist and getting a preventative x-ray to see what's going on. They, from what I see is they kind of rotate it around. They said, we're going to take this one, and we're going to do it so often. And that's exactly what we did. Was we brought him in, and he had a lot of plain films, hips, knees were fine, blah, blah, blah. And in that consultation, the orthopedic surgeon said, he's falling, we're not sure what the reason is, but the next step is a neurologist, which kind of surprised me. But ultimately we figured it out. So this notion of, if something's going on, you mentioned pain, right? And But when there's a change in condition or a change in anything, it's not a bad idea to go to your primary if you need a referral and say, listen, I want to get checked out. I want to make sure I get that consult, or I want to do it for my parent. Is that a fair thing? I mean,
100%, 100%. And not only for older age groups, but also for younger age groups, that same concept holds true.
yeah,
A younger, athlete like in high school complains of hip pain whenever he plays. And everyone says, oh, it's a growing pain, it's nothing. But there could be a hip dysplasia going
Yeah.
on. It could be what we call it femoroacetabular impingement, where the thigh bone hits the socket whenever the athlete bends the hip. Or it could be something similar going on in the knee. The kneecap is not tracking well. It pops, it kind of clicks. These are all precursors, potentially precursors for major issues down the road. So different age groups, when they have issues with pain and function, that's all orthopedics is all about, pain and function. There is a change in that and looks to be benign, but it just doesn't go away. We are used to having an ulcer or a bump or abnormal bleeding or weight loss being checked by our primary care doctor, but we just dismiss as a hip pain or a knee pain as unimportant till it becomes really debilitating. So this preventive approach to musculoskeletal care, unfortunately, doesn't appear to be the priority in our healthcare. We have other problems like cancer. I understand that.
and behavioral health problems.
However, in our
those.
community, we can do that. Worst case scenario, you're good, you're fine, go live your life. This pain is really, if that pain persists and bothers you, we can neuralize it for you, but we know that it's nothing. Or no, you have a major issue you have to look into. Oh, doc, I never knew that. You're the first person to tell me. I've had tons of these patients. You're the first to tell me that I have a bad hip, but it never hurt. But I would say it's important to know that, but it's gonna hurt at some point. So what can I do? These are your options.
It's when I listen to you talk about this, I think about the Olympics. How many times did we see a gymnast work through pain and just suck it up and deliver and perform? And I think about my own kids and growing up playing sports, and you would see it, but you want them to succeed, and you're proud of them, and I want you to get back in there. I want you to do this. How many times do we say, let's sit down and talk about what's really going on here, and taking it to the next step? Because part of the issue, and I'm at fault for this myself. It's like, oh, we got the state competition coming up. We got this coming up, and you want them to be able to do that. And so I think your advice is just really important. Is this kind of don't take some of those things as, oh, it's probably just this or probably this. To get it checked out, because as you said and you pointed out, often those things untreated or unexamined or identified can result in a problem later on in life.
Exactly. And there are more and more data on identifying underlying problems for major musculoskeletal problems down the road. With the term, we have this term idiopathic, as we don't know what the reason is.
Yeah.
Like idiopathic cancer, we don't know why the cancer happened. Idiopathic problem with the lungs or heart. But in musculoskeletal problems, we usually have something going on. We usually have a malformation, malalignment, overuse, some unrecognized injury going on. And I really want to emphasize the importance of identifying and addressing these problems at a younger age. We have the capability to do that at Bristol Hospital. We can evaluate patients for shoulder, hip, and knee, and all sort of sports-related injuries, and come up with a plan and come up with an advice. Hey, listen, this hip has a cam lesion. You are hitting this bump on your bone. We can get all the imaging and discuss it and show it in a very understandable way. We have everything available at Bristol to do that. Hey, you have this bump on your bone that each time you bend your hip, it goes into your joint and scratches your cartilage. So and you want to play hockey. That's awesome. I understand that. My son plays hockey too, and I love it. However, this hip is more than likely going to get arthritis when you are in your 40s. So your options are these. You either have to stop hockey, which I don't want you to do, or you will want to, or we can take care of this cam lesion so you can go back to playing hockey. There's the same thing about the knee, that the patella or the kneecap doesn't track very well. It's unstable, and each time a young athlete kneels or bends, it pops out and it pops back in, and the kid is kind of used to it. But each time it happens, part of the cartilage is lost. And that's the recipe for a disaster down the road.
Yeah.
And we are kind of used to, unfortunately, sitting till the problem becomes unbearable. Now it's time to go to the doctor. Now it's too late. We have to replace that knee. And it's an awesome treatment. I do that. I do replacement of the shoulder, hip, and knee. And when the patient comes in, I just change my hat. Okay, this joint can be saved. I can do whatever I can to save it, as opposed to telling the patient, oh, you need to go to someone else. I don't do preservation, but I do it. Or when the joint is beyond help, I would say, unfortunately, we have to plan for replacement. This preventive approach in musculoskeletal is unfortunately costly, is expensive. And as I said, as national health, in the grand scheme of national health, there are other priorities, which probably it's not the right time to have a national plan for hip or knee. But I would say general awareness is at least what we can do. If we have a place that we can go over and we can see what we can do. And when, well, unfortunately, the horse is out of the barn, when it is too late, they still have options that can help our patients.
Yeah, you talked about, I'm going to kind of play forward to the last part of what you were talking about. And you talked about, pain and a new procedure. And I think it's quite extraordinary that that's something that we're going to add to our treatment modalities, being able to do that. You talked about cryogenic ablation.
Cryoneurolysis, yes.
Cryoneuralizing. Okay, sorry for the confusion of the word.
No problem.
But to differentiate that from another approach, which is to ablate. So literally, if you have a nerve problem and it's extreme pain, and the medicine's not working, and you can't tolerate it anymore, one of the choices is to ablate it, or in other words, burn that nerve off, which we do, and it's quite effective. But if let's say you need a joint replacement or a knee replacement, and you have that pain, you can literally go in and freeze the end of the nerve using ultrasound guided procedure, and that will cause the pain to go away, likely for a period of time. Could be 6 months or something like that. And so correct me if I'm wrong, but you said,
no, you're perfectly.
I have a wedding, I have a big, lifetime vacation plan, I have some event planned that I need, you said earlier, moving, life event, so I can do this, get through the 6 month period, and then have that surgery that I need, which is going to ultimately take the pain away.
Yes.
That is really amazing.
That's something that actually kind of made me so happy, because we don't have a lot of options to offer these patients. This group of patients will benefit from this temporary kind of honeymoon type of thing.
Yeah.
And their nerve is going to recover, and they're going to come back for the surgery with normal nerves. The use of this modality is not just to buy some time, but also to get the patient through the pain of surgery as well. Let's say someone wants to get a knee replacement or a shoulder replacement or a rotator cuff surgery or an extensive hip surgery for deformity correction, for hip preservation purposes. We can do this ablation about 2 weeks prior to the procedure, and that there are studies, extensive studies, that shows that their pain is going to be half of the pain of patients without the neurolysis. Their range of motion is going to be recovered faster, and they're going to be off pain medication much sooner.
Which is awesome.
Which is awesome. So
Yes.
not just that, but also to help the patient get through the pain. And it's a reversible process, and I don't have any better options at this point. Either have to give them narcotics, which I'm very much against, and we all know that.
Yeah.
This does more harm than good. We can do oral anti-inflammatories like diclofenac, Advil. We all know that they have side effects. We can't prescribe them for more than a short period of time.
Yeah.
There are certain disease conditions that they have to take it, like rheumatoid arthritis, other inflammatory arthritis. They have no other options. But short of these, we don't have a lot of options. But cryoneurolysis is actually a new era of treatment for pain. A third group of patients, we talked about those who want to have a window, those who are having surgery, but there is a third group of patients who unfortunately appear to be living in a limbo. What is it? Let's talk about a bad knee. Their knees are bad, but they are not bad enough to get a knee replacement. They go to see a lot of orthopedic surgeons, but almost all of them tell them, hey, this knee is not that bad. It doesn't warrant knee replacement. They go to an orthopedic sport doc who does soft tissue stuff like ACL reconstruction, meniscus surgery, and he says, your knee is bad, but not good enough to benefit from any of those surgeries. So the patient says, so what should I do? What can I do? My knee is not that bad to get a replacement, but it's not good enough to get a hip or a knee preservation surgery. So he gets cortisone shot, viscosupplementation, or gel injection. They work, but not in a guaranteed way. They take as much as they can intermittently, NSAIDs. They sometimes have to resort to narcotics. These patients are also perfect candidates for cryoneurolysis.
That makes perfect sense.
We tell them, hey, we know what's going on. We don't want to burn any bridges. We don't want to deny you any procedure, but you really don't fit any of the known or effective procedures. But we have something for you to be as active as you can.
Yeah, this is incredible. Thank you. I've learned so much from you in this short period. And when you were talking about, the idea of taking that next step and the damage that can happen, I thought about this is a really simple kind of parallel to it. You buy a whole new set of tires for your car. You don't get an alignment done. You don't even look at the alignment. And the tires wipe in about 6 months and your investment is gone. And so when it comes to orthopedics, we shouldn't just get the new sneakers. We should make sure that the alignment's correct and all the rest.
That's the best analogy you could come up with.
I know it's simplistic, but any last words for the audience?
Thank you. I'm thrilled to join Bristol Hospital. I'm here for shoulder, hip, and knee from adolescents to older adults, and we will be happy to take care of you.
Thank you, Dr. Lebaschi. This is Kurt Barwis, and this is Bristol Health Cares. And you can write us with, questions or guests you'd like me to have on the show at cares@bristolhospital.org. That's cares@bristolhospital.org. I want to say a special thanks to Nutmeg TV. It is a nonprofit organization that absolutely deserves the community support. So if you're able to, please look up the website and help them out. It's just an incredibly important part of our community and one that helps bring information to all of us. And so thank you for viewing today. And until the next time, this is Kurt Barwis, Bristol Healthcare, signing off.